a co. She will also be a co-host.
Okay, great.
Irina, you are welcome.
Thank you. Thank you, Dr.
Yeah.
Boateng.
Yeah.
I hope I haven't missed anything yet.
No,
No,
you have. Thank you so much for joining us. Well, welcome everyone. We'll get started right now. My name is Andrew Morrison, and I am the co-founder for a wonderful organization called Mentoring in Medicine. For the past 15 years, we've helped, over 500 young people actually reach their dreams of becoming doctors, physician assistants, nurse practitioners, chiropractors, and on and on and on. And so we're really delighted to do something I think is historical, that, who is doing a medical mission in Ghana, who's doing a cultural exchange, connecting students here, both in the US and students and healthcare professionals in Ghana, for both of us to learn, to grow, and also to serve each other. Here at Mentoring in Medicine, we have a number of programs that go from elementary school all the way to career. And so we are a lifelong pathway program. And so we help from elementary students to, once you get your degree and you're an associate professor and you need to become a full professor, we're also there to support you with that as well. We're also very proud to have been supported by organizations like the National Library of Medicine, the National Institutes of Health, the Pinkerton Foundation, the Robert Wood Johnson Foundation, and that's really enabled us to create programs that can reach a lot of students at very low cost, because our mission, and it's your mission as well, is to really make sure that your zip code doesn't determine your life expectancy, is to really make sure that income is no longer a predictor of having a quality lifestyle. And so here at Mentoring in Medicine, we're really committed to making that happen in a fun and engaging fashion. And I want to begin with some music. I like music. And earlier I was talking to Dr. Prince by saying that, who said that learning, has to be difficult? Who said that learning has to be something that, is arduous and it's painful? And so I'm saying to you, it's possible for you to learn, for you to have a good time. This is a Friday. This is happy hour. How can we let the bars, take over the concept of happy hour? Why can't we learn, serve, and have a good time as well? So I'm actually from Jamaica. That's where I was born, Yemen. And so I love reggae music. And so this song right here is important, because you'll meet Dr. Prince in a second. You'll hear from other healthcare professionals and people who you may look up to. There's no need to really look up to them, because they're looking on the inside. They're operating from their passion. They're operating from what they love. And so this song right here is about loving your life by DeMarco. So you got to love your life, because when you love your life and you love your passion, you love your job, you no longer have a job. It's something that is going to last a lifetime. So I love my life. Hey, I love my life. I love my life. I love my life. Type in the chat room if you love your life. If you love your life, type in the chat room, love my life. You got to begin with that passion, love for life. You never know what tomorrow may bring. Why not live your best life today? Live your life today. Yo, I'm living my life. I do programs my way. I enjoy music. I enjoy science. I'm gonna mix it together. Hey. Hey. Live your life today. Oh. Love your life. Love your life. That's the key. Yeah. I mean, how do you begin your day? I want people in the chat room. Tell me right now, how did you begin today? I began today at 5 a.m. You know, I began today in meditation, in prayer, in exercise. You know, I began today with passion, with energy. So people think I'm always Mr. Positive, I'm always Mr. Encouraging. No, I have habits. I have morning rituals and evening rituals. And so in the morning, I begin my day with a sense of expectation that today's going to be the best day. Okay. And I want to encourage you to begin every day like it's going to be the best day. And as you close your day, you close your day with a sense of gratitude, being grateful for what happened today. And you imagine tomorrow will be the best day. So if you can really begin to add love in the midst of organic chemistry, you know, add love in the midst of pharmacology, then you will always be successful. So let me turn it over to my other MC, none other than Dr. Prince, to give some brief introductions. I'll put up his slide presentation and also introduce some of the students. But you take it away, Dr. Prince. I'm going to, I want to decrease to let you increase.
Andrew, thanks so much. Wonderful introduction. Hi, everyone. Welcome. Thanks for the opportunity. Thanks for joining in. So my name is Prince Obed Boateng. I'm a medical doctor, as Andrew has introduced. I've actually not been doing this for very long. I've been a doctor for about 5-6 months, but it's been a wonderful experience thus far. Support from colleagues, support from bosses. My own boss that if I have to mention any name, Dr. Mankra, I don't know if he's on here yet, but I just want to say that it's been a wonderful journey so far. So I just want to give a brief about myself. I also love my life, as Andrew has described earlier, and my normal day is waking up with a prayer, with some exercise if possible, and then I move on to the torture that awaits house officers in Lekma Hospital where I work. But one thing I really want to emphasize about this whole my life is how my education has been like. So I've had about 10 years or so, more than 10 years of tertiary education, and before I was able to make it to becoming a doctor, to having all these awards that came with that qualification. So I had to do 4 solid years of tertiary education before I did extra 6 years in medical school. And the course of that journey, there are 4 solid things that I have picked up and I believe have altogether helped in shaping my life. One of them is humility. Andrew, I think I've always been mentioning humility, and it's important to me because I believe that if you are not humble, you don't get to learn anything from anyone. And in life, there is always something to learn from somebody, regardless status. I mean, everybody has something to teach, and so that is one thing that I have picked up that I think has helped my journey. Another is the next is self-motivation. You know, the journey has always been tough. There will be times that you break down. There will be times that you'll be overwhelmed, and you need to pick yourself up. And so severally, myself, I had my own challenges in school, but I had to pick myself up again. And that is it. Sometimes we need to stay self-motivated, motivation from within. It doesn't always have to come from outside. And I believe that is something that has also shaped my life. The next is focus. You know, there are so many things that are out there to distract us. And so you need to have a goal, and you need to set your eyes on that goal. However tough it may be, you need to accept everything that comes with the journey, and ultimately aim at achieving the goal. So focus. I think the last of these 4 things that I have been instrumental in my life is avoiding procrastination. When I earlier in my schooling years, anything I had to do, I would say I'll do it tomorrow, and tomorrow I'll push it to tomorrow. And I noticed that although I had the capacity to do so many things, I was almost always procrastinating. So I ended up doing nothing. And at the end of the day, it affected me. So I'm emphasizing this whole these 4 items because all through the 10 years of tertiary education to becoming a doctor, I've noticed that without them, I wouldn't have come thus far. So away from education, as I said, I'm Ghanaian. I'm a doctor at Lekma Hospital. Is in a district called Tishin in Accra, and I think we as a hospital that is doing quite well and that needs to be commended. All right. So I wouldn't want to bore you too much with my own self and all of that. Today is more of an interactive session between all students and all participants. So enough of myself. Andrew, could you move to the next slide, please? All right. So how is the healthcare structure like in Ghana? I really want to bring this up again, that healthcare in Ghana also focuses on the primary healthcare, as was agreed on by the during the Alma Ata meeting, or the Alma Ata Declaration of 1978. And the definition of primary healthcare is a long one, but every item in there is essential. So it reads, primary healthcare is essential healthcare based on practical, scientifically sound, and socially acceptable methods and technology made universally accessible to individuals and families in the community through their full participation and at a cost that a community and country can afford to maintain at every stage of their development and in the spirit of self-reliance and self-determination. So all the countries that were present during that meeting in 1978 agreed that healthcare in any jurisdiction, regardless, should have these entities that have been spelled out. And that is what Ghana has adopted over the years. And so in Ghana, following this definition of primary healthcare, we have categorized or arranged our healthcare system in a way to achieve all the elements in that definition. So we have it in levels: level A, level B, and level C. The CHIPS, as you see, stands for community based health planning and services. So it's more like the very first point of contact that people in the villages in remote areas in Ghana would have the opportunity to have some healthcare access. So these facilities are usually, you see an image of it in the next slide. They are usually simple buildings where basic health services are provided, like family planning services, treatment of minor illnesses like malaria, which is tested before treatments like gastroenteritis. So basic stuff can be achieved at this level. And then we rise to the level B, which is a health center. And that is more of an upgrade of the CHIPS, where we may have a physician assistant manning that facility. And so we step it up to involve more sophisticated healthcare, if I may put it that way. So this level is usually found at the sub-district level, with a physician assistant probably manning that health facility. Sometimes we may have a doctor in there as well. And then we move to level C, which of course adds on as necessary, where we have the district hospitals, the regional hospitals, and the teaching hospitals, where we have more advanced healthcare services being provided. So Andrew, we see early on, Andrew, if you could show the previous slide. Yes, so that is a CHIPS compound, as I mentioned, a simple house. And then the next slide, please. That shows, this is actually my hospital, Lekma Hospital, where I work, which is more or less a district hospital. So district hospitals may look something somehow like this. All right, and let's move on to talking about some healthcare advancements against pressing issues. So what are the commendable developments in healthcare thus far? And then what are some of the challenges that are still lingering in our healthcare system? The last time we had a discussion, I mentioned that over the period, we've been able to have 307 new ambulances in Ghana, and I must say that is awesome. That has come to solve so many health problems in this country. We've also seen the advent of more medical schools to help increase the numbers, and we improve upon the doctor-patient ratio in Ghana, which aforetime had been abysmal. We also have to commend the fact that government, and then, if I may say, the Ministry of Health, they are all paying more attention to non-communicable diseases like diabetes, like hypertension, which are now more or less taking center stage of our healthcare plights in the country. Before time, our focus was more on the communicable diseases, malaria and the others, and then HIV. But at least for now, we can say that there is some attention being given to the non-communicable diseases, which are also causing so many problems. So there are several, of course, advancements, developments that have been made, but these are a few ones that I need to highlight. Now let's look at Andrew. The next slide will tell us about some of the challenges that are still persisting in the country. And then we notice that, of course, we still have issues with infrastructure, issues with logistics, issues with basic resources to work with. Sometimes a patient in this COVID era, a patient may need oxygen, and to get a flow meter sometimes in my hospital becomes a problem. There was a time that I was looking for a non-rebreather mask to support somebody who needed more oxygen delivery, and I had to struggle to get some of these items. And you know, these are not extraordinary. These are not these are things that I think that we can and ought to achieve. And so infrastructure, logistics, resources to work with, they are still issues that we are battling with in this country. Next is remuneration or motivation for the healthcare worker. The truth of the matter is that I had been working for close to over 4 months, 5 months, and I had and even when the salary has come, working environment, and then everything about the work has been. So sometimes the motivation is not there because you are working and you are not being appreciated as you think. You have to be appreciated. The next of the challenges is still about education. Education, because I mentioned education because we noticed that yes, the theory you pick in class, but sometimes getting the in-depth understanding of some of the theoretical knowledge that we acquire to be able to apply them practically becomes a problem. And so we realize that you have all the knowledge, but then when the work is there to be done, there is some struggle of a sort. Again, the education also has to deal with still trying to get more medical schools, more facilities to help train doctors, health professionals, and the like. The other aspect is still with leadership. And I think the least said about that, the better, Andrew. So having looked at, talked a little about myself, looked at a few developments and then some challenges in our healthcare system. I've highlighted education because we are all already zooming into the next session of our discussion today, which Andrew is the interactive session where we have three Ghanaian students coming to tell us a little about themselves. So Miss Irina Gatti, we have Mr. Thomas Adi, and then we also have Nana Akosa, who also shares something with us. So I don't know if Thomas is ready. Thomas, are you ready? Or Irina, are you ready?
I am. Will
Okay.
you share my slides?
Okay, great. Thank you so much. I love your outfit. Talk to me about the outfit that you're wearing.
I didn't get that. Could you please say that again?
You know, I was saying how I love your outfit so much.
Thank you.
I want to hear more about your outfit.
Great, thanks. It's just, I'm just repping my country, Ghana. Yes, this is right. I'll need someone. Okay, great. So thank you very much, Dr. Boateng. Thank you, Morrison. And my name is Noreen Irina Gate. I am a fourth year medical student at the University of Cape Coast School of Medical Sciences, where Dr. Boateng trained, and we are so, so proud of him. And I am really happy to be a part of this program and to share a bit of me with all of you. And so, next slide, please. Next slide. Okay, so before I talk about my career goals, I chose to be in this profession, I mean the medical profession, because I saw it as one of the best opportunities of not just giving back to society, but to share my life with others. And so, next slide, please. So my topmost goal right now is to obviously finish medical school, which is getting quite tough. And also I like to excellently play my part in restoring health and wellness to all who need my services, especially children. I have a soft spot for children, so I'll most likely become a pediatrician in the future. And lastly, I would like to help people like Dr. Boateng improve the quality of our healthcare delivery systems in Ghana. And my challenges are no different from what the ordinary medical student goes through. And I occasionally experience burnout from increased workload, from increased expectations, and from insufficient time to study, especially for my bi-weekly examinations. Yes, and there is also lack of enough patience to learn from and to clerk due to COVID-19 pandemic. It's it's reduced patients in inputs, or it's reduced patients coming into the hospitals a great deal. And so we have very few patients to learn with. And again, there isn't enough ward space in our hospitals. And especially for my class, it's the first time the school is having such a big number for one class. And so when we go to the ward, it's very difficult to just be around for bedside teaching. And so some of us are too far away from the supervisor, others are also quite close. And it's quite challenging. And lastly, there is limited supervision from there is limited supervision from our clinical mentors, again, due to our size, and they are also almost always busy. Their main attention is on the final year students and the house officers, so we don't tend to get their attention most of the time. You have to chase them at odd hours, and it can get a bit challenging. So these are the highlights of my life right now as a medical student in Ghana. And thank you for your attention. Do enjoy the rest of the program.
Yeah. All right, thank you so much. Let's give her a big round of applause. I love it. I love it. I love it. And because as you're talking, we're thinking about some new programs, some new initiatives. And so we can definitely have some physicians here in the US, kind of do our own version of grand rounds. And so we can also be able to support you virtually as well. And so, Dr. Prince, who's next?
Yeah, so Thomas, are you ready?
I think I'm ready.
Yes.
Are you sure, Thomas? Because she did a very good job. So, Thomas, you have to come really strong now, okay? All right.
Thank you very much for this opportunity. Please, could you share my slide?
Is this your slide, Thomas?
No.
No, this is for this is the next one. The next person who.
Oh, okay. You know what? Give me a second, Thomas. That was sent to me via email. Let me see here.
Okay.
Dr. Prince, did you email me Thomas's slide? I saw Edwards and yeah, Thomas. So, Dr. Prince, are you able to email me Edward's slide right now?
All right.
Thomas?
So let's go to Edward. Then I'll work on Thomas in a minute.
Okay. All right.
So we have Nanakos.
So Edward.
Okay. Hello everyone.
Hey, how you doing, Edward?
I'm good. How are you too?
Good. So I've spotlighted you. Everyone can now see you, and I'm going to share the screen as well. So take it away, Edward.
Okay. Have you started with the slides?
Yes.
Okay. So, my name is there. I'm Nana Akosa Danso. I actually prefer being called Akosa. And the title of my presentation is more or less academia practice. It's a term I coined up myself, which would be explained in the following slides. So I'm also in the University of Cape Coast where Dr. Prince Boateng trained, and I'm in the final year. So I think you can go to my next slide. Okay, so basically I'm referring to research, analysis, research, and publication in clinical practice. And what I've noticed in medical school, 6 years of medical school, is the lack of research and lack of publication, especially when you compare what we do here and what is done elsewhere. And I believe that research and analysis of the data we have is the basis for progress and new developments. And it's not a priority for medical students at all. And I think we'll see the reason why in my following slides. And the clinicians, I put a question mark there, whether clinicians also venture into academia practice. And when I say clinicians, I don't mean clinicians who are in academia. I mean clinicians who just practice medicine in hospitals without any lecturing as part of their daily routine. Do they actually publish a lot? Do they actually do some research? So that's basically what academia practices, research and publication. Next slide, please. So why should we do it? And my first point is why not? Why shouldn't we research? Why shouldn't we analyze the data we have? And why shouldn't we publish? And the second point is because there's a lot of data. I'm currently in final year and I'm doing my dissertation in hematological malignancies. And I realized that we have so much data and no one is analyzing it. No one is drawing conclusions from the data. And let's say if you are drawing any inference, we tend to draw it from something that was published outside the country or even outside the continent.
Akosa, I'm sorry for interrupting you, but what did you just say? You said something you're studying, but I think a lot of students may have missed it. What are you studying again?
Okay. I was saying I'm working on my final year dissertation on hematological malignancies.
Stop. I want you to say it again for everybody really slow and define it for everyone as well. So say it again.
Hematological malignancies.
Wow. Now, what is that?
Basically, it's cancer of the blood.
Oh,
Basically.
okay.
Basically.
All right,
Yeah.
good. Keep
So
going.
we call them liquid tumors because you usually don't have solid cancer. So basically what I was saying is that there's a lot of data which is not being analyzed, and we tend to make inferences from publications outside the country or even outside the continent. And another reason why we should do academia practices, it serves as a basis for assertion and tailoring of our management. I give you a typical example. So when I was in my surgical posting and we were doing basic metastasis of breast CA, we tend to, everybody knows that, okay, metastasizes to the liver, to the lungs and whatnot. But then why are you saying that? Is it because in, let's say in a Caucasian, that's where metastasized to? But we don't have, no one has really analyzed the patterns of metastasis, especially in my hospital. So we don't have any basis for making that assertion. We are just relying on what someone else has published. We are saying that, okay, this is where breast cancer goes to. On what basis? And you also tailor, we need to do that to tailor our management. Again, my point is tailoring our management to what has been published elsewhere. You might realize after analyzing our plethora of data, you might realize that our patterns of diseases might be different. But since we are not analyzing, we are basing everything on what others have analyzed, where we know genetically that we might be different from others. So we need to analyze it. And the next reason is, I'll skip the fourth one. The next thing is it gives recognition in the sense that you find people making names in medicine because they research, because they analyze the data, because they synthesize everything, and because they publish. Can we go to the next slide, please? Okay, so this is basically a historical context, and it's more or less supporting why we need to do academia practice. First of all, medicine is dynamic, and you realize that after every 5 years, protocol changes in medicine. Maybe after every 10 years, what people were doing in the 19th century, bloodletting and all that, you realize that no one does this anymore because medicine is dynamic. We are realizing a lot of things we're doing were wrong. And I like to combine the second and the third point, intuition and experience and evidence-based medicine. From my research I did before making this presentation, you realize that most discoveries initially were based on intuition. But now everyone is moving towards evidence-based. What does the evidence say? Clinical trials, what are the clinical trials saying? But then the intuition, I'm not saying we should base what we practice on intuition, but I think there should be room for intuition, which should be tested. Not just what is currently being done, what's the evidence, or why are you doing this? Sometimes you can give room for some intuition, test it, and that can also improve our quality of care. You also realize that everything is about pattern recognition. Everything is about pattern recognition. I give you a typical example of Edward Jenner recognizing the pattern that milkmaids who had been exposed to cowpox were immune to smallpox. It's all about recognizing a pattern. And we get the historical context from that. And also, medical students have contributed their quota in the development and the revolutionarization of medicine. I gave some example, which I found, Paul Langerhans, discovery of insulin, heparin, and the sinoatrial node. These are all basically medical students bringing that onto board. Can we go to the next slide? Okay, so my emphasis on medical education and medical students. Why don't medical students do a lot of research? I don't know what pertains in other countries, but basically in Ghana and in my medical school, it's all about time. We go for lectures or we go to the wards basically the whole day. No one has time for any, I like to call them extracurricular academic activities. No one has time for anything like that. You're basically learning your medicine, you're basically learning your surgery, and you don't have time for anything else. The second point is that It's not academically rewarding. You can spend your time to analyze, let's say, you see a lot of things being done in the hospital. For example, after most general surgical procedures, patients are either placed on Cipro and Metro or placed on ceftriaxone and Metro. You can take your time to analyze the effectiveness of the various combinations, but then no one will reward you for doing that. Everybody is looking at, can you examine this hernia? Can you examine this breast lump? Can you examine this GI system? And that's where you're going to get your marks from. That's what is going to make you a doctor. In effect, that's what's going to give you your degree. So no one is going to reward what you want to analyze. And that kills curiosity in my third point.
What's Citro, these drugs you mentioned, what do those drugs do?
Ciprofloxacin and metronidazole, they're antibiotics.
Okay.
Yes. Yes.
Right.
Then my fourth point is also a term I made up, lacatus fundatus, basically lack of funds. Most yes, you need money for a lot of research, and like Dr. Prince Obed mentioned, we've not solved the basic amenity, the lack of the basic amenities, and you're talking about money for research. I'm not sure we are going to get it. And when the last point has to do with our clinicians who do a lot of research, but we don't get time to incorporate ourselves. I think because of time, I'll just go to my final slide and I'll be done. The next one, yes. So I recommend that there should be partnership with faculty, and students should be rewarded, let's say, credit hours for spontaneous research. I don't mean research where people are, let's say, like my dissertation I'm doing in final year. I'm actually supposed to do it. So it's not a spontaneous research. If I don't do it, I don't graduate. So I think credit hours should be given for spontaneous research. Then I think I mentioned the third point, combination of evidence-based and tested intuition. And when I talk about research, which comes to my fourth point, a lot of people look at vaccine trials, discovery of new surgical techniques, discovery of new drugs, but you can start small. Analyze the patterns of thyroid disease in your hospital, analyze the distribution of cancers in your hospital. Then gradually you can build up and catch the big fish. And after you're done with medical school and you're in clinical practice, and you're not even in academia, I think you still have to conduct some research. Then I think my final slide summarizes who I am and what I believe in. Yes. And I put my fourth point, my specialty. What the specialty I want to do is, I call it pseudo capricious, because it's always changing. What I want to do is always changing. Sometimes I think I want to do surgery, orthopedic, oncology. Yeah. Yes. And I actually really like solving problems. Yeah. I'm a chronic thinker. I like thinking about different scenarios and looking for answers to various problems, especially in the healthcare and in life in general. So basically, that's it. Thank you for your time.
All right, thank you so much. Pseudo capricious, you're a chronic thinker. Geez, where have you combined, mash up these adjectives? It's very powerful. So thank you so much. And I want you to hold Mentoring in Medicine accountable, because I believe that we never really lack money. It's really about the vision. And here at Mentoring in Medicine, we want to put the vision out there that we can maybe even fund a research scholarship. So stay tuned. We got some great plans coming up. All right, so Prince, who's next?
Do you have these slides now, Thomas?
Did you email it to me?
Could you check your email if you? I think I just did. Is it in there?
All right. These are great suggestions that were shared to us. And while my email is loading up, wow.
Okay.
This is very interesting. I think too many screens up. The computer starts to get slower and slower and slower. All right. Okay. Hmm. No, for some reason, I'm not seeing it. I'm not seeing that email right now. Could
All
you?
right. So Thomas was supposed to be the last student to share a few thoughts from my end. And do you have some students to share anything with us?
Yes. And so I want to turn now to the mentoring and medicine family. And I would like to have one of our students or anyone who's been involved in mentoring medicine programs. I'd like you to raise your hand, and I would love for you to kind of share some thoughts, some insights. We really want to make this kind of a cultural exchange. And so go ahead and raise your hand. I'll kind of unmute your line. I have a couple of twins who actually just made the, well, you know what? I won't actually announce the good news. I'll see if they want to share it. So anybody from the USA side would like to introduce themselves and say a few words, let's go ahead. Don't be bashful. And let me see if I can call on somebody. Hey, oh, okay. So T Golden. Let me see. Make you. So you can go ahead and unmute yourself now.
Hi, my name is Tiffany. I'm
Hi.
from the US. I'm actually applying to medical school, so I'm going through the process of applying. I had a question about your match system there. Here, after the first 4 years, you go through a match system that based on your body of work and letters of recommendation, you say what specialties you're interested in or what type of medicine you want to do, and they match you with it. You sort of like win the right to practice that type of medicine and be further trained in that. Do you have the same program there?
Okay.
Hi.
Yes.
Hi.
Unfortunately, that is quite different in our setting. For our setting, even at full-time, it was 7 years of straight 7 years of medical school education. Over the few years, it's been reduced to 6 years. So for us, you have to do all 6 years of medical school. When you are through as a medical doctor, you do 2 years of housemanship or house job, after which you are then free to pursue any other specialty of your choice. So that is how it works in our setting. If you are going in as a graduate student, i.e., if you have done a previous degree and then you are coming now to into the medical school, then there may be there are some programs that would allow you to do about 4.5 years more in addition to the previous certificates that you are coming in with. So unfortunately, our system is fortunately or unfortunately, I must say, our system is quite different from what you have in the US.
Oh, okay. Because I was thinking like here for us for doing research, some schools require it and some schools don't. But overall, unless it's a motivation for your school, then research isn't like something you absolutely have to do. But one thing that became clear during the pandemic is that everybody needed to be doing research because it was the primary care physicians that brought to everyone's attention that, hey, these tests that you're using, they're actually inaccurate. The FDA approved them, which is our governing body, approved them for use, but they're giving the wrong results. You might be releasing a whole bunch of infected people in with healthy people. And so now the schools are talking about reworking it where they want to have research as a main crux of the education. And so I've now refocused the type of medical schools that I'm looking for ones that focus on research. So I was thinking that through our match system, they're putting more emphasis on looking at what type of research you've done before you didn't have to do it to get you matched into a certain program. But I guess it's kind of different there, but I would like to learn more about like how you go into your different specialties and things, and maybe even do like an away international rotation, because I feel like seeing things from each area's perspective and their approach to it just kind of broadens everyone's perspective of how to treat certain things. But thank you.
No, absolutely. So I want you to pack your bags from now because we're going next year. All right, Dr. Prince, I didn't tell you this yet, but I'll pick a date for us, and we're going to come out there physically next year. So
yeah, we are waiting here. We are patiently waiting.
All right, great. So I think these are the Warren sisters. Let me see if is this the Warren sisters. I got some twins that are dynamic. Let's see here.
Hi. Yes, can you hear me?
Yes, I can hear you.
Hi, my name's Marissa, and Cameron is also here. She's my twin sister. And we also have 2 younger sisters and an older sister, but yeah. And
so tell us more about your academic journey. Do you want to share your good news with us? Tell us about your interest. Go for it.
yeah, so my twin sister and I were sophomores in college. We're bio majors and chemistry minors. And so through our program at our school, there was an early opportunity in medicine program, and where you got to apply to medical school early. And we went through the whole process of filling out applications, gaining internships, and trying to gain those clinical hours. And then we had 2 rounds of interviews, and we found out early last week, that Cam and I got into the medical school that's local in our community. So in 2 years after we finish our undergraduate, we can matriculate at that medical school. So yeah.
Yeah! Hey! That's a big deal.
Yes.
Like that's you have no idea how there are people twice your age who are going crazy about getting to medical school, and you're a college sophomore and you're in medical school. Everybody, big round of applause. And when you win that Nobel Prize in biology or chemistry, after you thank your mother and your parents and your family, put my name in there, okay?
No, definitely. We want to thank our MIM family for just providing us with a lot of different experiences that not only helped us become like more holistic applicants to medical school, but trying to open our eyes to the different health disparities outside of our own community to try and be better physicians in the future.
That's great. That's great. Okay, so we're looking forward to great things from you. Thank you so much for joining us. All right, great. Next up, Beatrice. Come on down.
Good afternoon, Dr. Morrison, and good evening, Dr. Prince.
You don't have to call me doctor. I don't have a PhD, but I've tutored many people who became doctors. But Mr. Andrew, Mr. Morrison, just Andrew, Drew, in college they call
yes.
Go for it.
Yes. Good afternoon, Mr. Morrison, and good evening, Dr. Prince. Mr. Morrison, first of all, I just want to say thank you for this opportunity and this platform you provided for us. I was a participant in Mentoring in Medicine back in 2017, and it proved to be a very rewarding experience. So I just want to say thank you very much for that. My question this afternoon is for Dr. Prince. So Dr. Prince, I am from Ghana. I came to the United States when I was 6 years old, but I did most of my education here in the United States. And my long-term goal is to eventually go back to Ghana and practice medicine. So I was wondering, what advice do you have for somebody like me who wants to obtain an education here in the United States, but also wants to go back to the motherland and give back to my people?
All right. At this point, I don't know whether to say the whole truth.
Be careful. Be careful. Okay. So maybe you and talk afterwards. But
I would. Beatrice. I mean, I think Ghana will really benefit from your experience and your expertise that you are coming to to help with. And then I don't think that I will stand to discourage you in any way. The only thing I can say is that, yes, you may not have the environment will be different, the working conditions will be different, definitely will be different. But then if you do have the desire to come back to help your motherland, then I think you don't have to think twice about it, regardless the challenges that may present. I think it's a great idea, and you should really consider it moving forward. Yeah.
All right, great. Dr. Prince for president of Ghana. As a politician. Good. All right. Anyone else want to raise your hand, ask a question, share your journey? All right, I will go to Georgina.
Yes. Hello, my name is Georgina, and I am also a Ghanaian. And so good evening to Dr. Prince, and hello everyone. I have one question. So right now I am a senior in college, and my goal is to go to medical school. And I also put like a question in the chat box asking in terms of like education when it comes to educating the community, when it comes to like cardiovascular diseases, diabetes, like how is that education going? And also I have my second question is, if someone wants to come back and volunteer, is there like a program in Ghana where that will allow like just college student or after graduate student to come into Ghana and volunteer at the medical settings?
Thank you so much. So to your first question, that had to do with the non-communicable diseases. I think I mentioned that earlier, that over the period, we've noticed that at least the government, the Ministry of Health, the Ghana Health Service, they are paying some attention to the non-communicable diseases like diabetes, hypertension, because almost every now and then in my hospital, people are coming in with strokes, people are coming with heart failures, and these are all complications of these conditions. And so yes, there are advancements towards trying to address those conditions. The education is out there in my hospital almost every day. At the outpatient department, we have some professionals who educate the patients who come around on the risk factors of these conditions, on how to manage them, those who already have them, the need for compliance, and then compliance in terms of treatment and all of that. On the television, on the radio, I mean, the media is also doing well. So yes, the awareness is now out there, and everybody is contributing their quota. I must say that before, people were more focused on the HIV, tuberculosis, malaria, and those other things, those communicable diseases. But at least over the days, we can see that there is some appreciable recognition for these conditions. To your second question that had to do with volunteering, yes, there are even exchange programs. I'm sure Akosa can tell us more. In the University of Cape Coast, there is a program for Ghanaian students to travel elsewhere, and other students also come around at least for a few weeks to share experience, learn, and then also volunteer. And then if you are also interested, besides the school system, I'm sure there are also peculiar programs that have been designed for purposely for these conditions. And when you are ready, you can always send an email or send a chat, and we can take it up from there.
All right. Outstanding. And so I want to jump in, but also we have it's Thomas's email, and so I want to get Thomas's, not his email, his presentation. And so, Dr. Prince, I just sent you an email with my other email address. So if you can try, I think I put it in the WhatsApp. So let's try my other email address so I can get his presentation. But I want to next up have Dr. Prince talk about first aid, because our first project is going to be first aid. But before I do that, because I'm not so much about, about talking, I'm really about organizing and making things happen. We have some great ideas here. The fact that we have nearly 100 people here, and we have almost 230 people who signed up is a big deal. So right now, I would like to, I want to give a little break while Dr. Prince is looking for Thomas's presentation to resend me via WhatsApp. Also, you can send it to me via the other email I sent you, Dr. Prince. I want to talk about organizing, everyone. And there's a great website channel software called Discord. It allows us to organize our conversations in channels. And it's very similar to Slack. So in the chat room, I just placed the Discord channel as well. And now what I'm going to do, I'm going to go ahead and share my screen and let you know, show you how Discord actually works. It can be a little bit, confusing when you begin, but trust me, it's one of the fastest growing communication tools right now. People are going away from emails and having these types of channel like conversations. I'd encourage you when you join, because we have healthcare professionals here as well, don't join with a nickname. I'd like you to kind of join with your first name or your last name. Please be as professional as possible when you join the Discord channel, because you're being watched. You're being watched in a good way. Somebody wants to give you a scholarship. There are deans of admissions who are part of my program who are just around here, looking at students, seeing what they're doing, and seeing who they should work with. So this is Discord. Once you sign in, your first will come to this introduction channel. You can go in here and just introduce yourself. You can just say maybe what school you go to, what your interest is. So we have Helena, Rashina, and Fabrice is here so far. You can mention your interest. And then also, as we begin to develop our projects, you'll see different channels will begin to pop up. So our first project is going to be first aid kits. And I'll be reaching out to some of you to actually serve as a moderator for that. And also, we're doing a program with neonatal resuscitation, and it's called Helping Babies Survive, and also helping babies breathe. And we will be developing lesson plans for middle school, high school, and college students around helping babies survive. The neonatal mortality rate in Africa needs to come down, and you are the solution. You're the solution that we're looking for. So I'd like you to join Discord, join our introductions channel. I will post up here the YouTube video. We'll post up different resources as well in terms of exchange programs and so on. All right. Okay, so let us now go to, I want to play some music. All right, we're going to be ending in a half an hour, and let's do a little stretch break. And so, Dr. Prince, why don't you introduce this this song I'm about to play? Tell me about it.
Yeah, so this is a song by This is a song by Kwame Eugene, Ochame Kwame featuring Kwame Eugene, and the song is titled Yekun, and in the local dialect, all it means is we are fighting. So it's a song that denotes the struggle of the African man, the Ghanaian man, or any individual for that matter, and this is a struggle to success. Yeah, so that's all about it. That's what the song is trying to talk about.
All right, great. So we are fighting. So let's get ready to play this song. Cool. So this song will probably go for like 3 or 4 minutes. So if you need to take a bathroom break, take the bathroom break, listen to this song, get up and you can stretch, and we'll be back to hear about first aid. So let's go ahead and play this song.
Coming here today. Yes! Yeah! Let's go! Oh, yeah, yeah. Where this guy? Got 2 bottles and 1 house. Young get free, but yeah, I am 1 GFM. Kaya Jessica, yeah, you say I'm Bogampa, Yani, yeah, babe. They won't come by. They need a sponsor. I did answer. They won't come by. They need a sponsor. I did answer. Push him some for Bridget. Drill it. We are not tired, grill. Empty pockets, send away shit. And Joe, what you best feeling? Yeah, cool. Watching the John come freckle. What them best I can't do, who come let's go. Now, 5 I change up. Yeah, whoa, now so. A super so bad, so. Then I got my mom wants to go laundry. When you man, I had to eat to the city. There's a little oil and care. We have the Sasu baby gun and tear. Yeah, consume your yeah, I feel like you're busy. Scratch it, edge it, matches, fash it, what I can't get free, cause yeah, I am 1 GFM. Kaya Jessica, yeah, say I'm Bogampa, yeah, babe. They won't come by. They need a sponsor. I did answer. They won't come by. They need a sponsor. I did answer.
Rockstar made it. It's the Rockstar. Oh man, I don't know what they were saying. Dr. Prince, I hope that was clean. Dr. Prince, I hope they weren't saying any bad words because
clean. It was all clean. It was all clean. And someone was just asking me why this song now. For medical students, I think this is our song because it's a struggle every day, and it's all clean.
Hold on 1 second for me. All right, yeah. So keep going. Explain why it's so important. Go ahead.
So about this, I thought it will remind us of our constant struggle. As Akosa mentioned, UCC, University of Cape Coast, is tough. Medical school is tough. So it's a constant struggle, and every day is a reminder that regardless how the struggle is, yes, at the appointing time you prevail if you don't give up, more or less. Yeah, so it's all clean, Andrew. It's all clean.
It's okay. I mean, once again, I'm from Jamaica, and I like 90s dance hall music. So we all got our ways to release. It's all righty. So someone had mentioned that they had a hard time logging in to the Discord channel. I just changed the moderation level. So why don't you try to log in again? and that should be the way you can log in. Okay, so Dr. Prince, we ready for first aid?
Yeah, we are ready for first aid.
Okay.
And Andrew, first aid, why first aid? Because someone that will be wondering, why are we talking about first aid? It is just one of the many projects that we have in the pipeline, as Andrew mentioned earlier. And first aid is, Andrew, could you share the rest of the slides if it's possible?
Yes. And I want to gear people up because we're planning a fundraiser and we're going to be sending first aid kits. So stay tuned. This is about action. So go ahead.
All right. So I'm sure in the US, many people will have first aid kits in their homes, in the schools, and all of that. But yes, in Ghana, some homes may have, but many homes you wouldn't consider that a luxury. And so this first project is looking at how we can get as many homes as possible in all schools, not only schools in Accra, but it is where they need as much as possible. Up until now, quite recently, that we had so many ambulances coming and being purchased in the country. So before you could even move a patient from the home to a health facility, may be a struggle, especially a patient who is severely ill. And so some of these equipment, some of these medications in our first aid kits, of course, in our setting, will be invaluable. But the other aspect of it is that there is also the fear that people will then rely on the pain meds and then abuse them. People will then may ignore visiting health facilities when necessary because they probably think that they already have all the things they need to have in their home. More or less, they have a hospital in their homes. But that said, it doesn't negate the fact that first aid kits are pertinent in almost every home, every school, every office as much as possible. So why are we talking about first aid? First aid because in the Ghanaian environment, we see so many common conditions like acute gastroenteritis. Somebody may have eaten some food poisoning. The person is suddenly vomiting. The person is suddenly having diarrhea, stools. Somebody has an abrasion, contusions, lacerations, some minor burns. Maybe you were cooking. Our elderly are almost always falling down. Some may have fractures, others may not. And then the medical student or any other worker for that matter, after the stress of the day, may have some tension headaches. Some have persistent allergies. They are allergic to almost everything. And then the sprains and the strains, upper respiratory tract infections, where people have nasal congestions and all of that. So these are common conditions that we see in our setting and may not necessarily demand hospitalization or visiting a healthcare facility, but could be initially at least managed before the consideration of taking the individual to a healthcare setting comes up. So Andrew, the next slide. Having appreciated why we need such the first aid kits in our homes, what are some of the items that we are looking at in trying to build a comprehensive first aid kit? So we need adhesives. The list is not exhaustive, I must say, but at least if we had these, it will be
okay.
If we had so adhesives, sterile gauze pads, antihistamines, as I mentioned, some people may have allergies. Antibiotic cream to at least put on some wounds to prevent the wound from becoming infected in the acute phase. Some people almost always have dyspepsia, or they are bloated, and then they have uneasiness in their abdomen. So antacids may relieve them. Pain is, people may have headaches, fall from develop pain. So analgesics are important, antiseptic, and personal medications for chronic illnesses. So yes, the first aid kit may be for everybody. So in the household, everybody may benefit from that first aid kit. But then there may be the father of the home, the mother of the home, who perhaps will have some chronic illnesses that will require some particular medications. And so having all those together in a particular box, or yes, in the first aid kit, may even make having access to them easier. There, besides the medications, there are also some items or some equipment that may be necessary in having a comprehensive kit. Like we need a pair of scissors to cut, gauze to cut, bandages where necessary, a thermometer to help check temperature, disposable gloves, safety pins, tweezers, etc. And I put here oral rehydration salt because in my hospital setting, almost every now and then people are coming in with diarrhea and vomiting. And so even before they come for any assistance, they could have taken these oral rehydration salts at home to at least replenish the fluids that they have lost. Cough medication may also be necessary in trying to build a comprehensive first aid kit. So Andrew, I wouldn't talk too much about first aid kits because I think it is common knowledge to all of us, but we did mention it so that we just have to introduce it as our first project. So Andrew, yes, the next item has to do with other projects that we will have in the pipeline besides the first aid kits, and how to actually realize our dream of getting first aid kits, as many as possible, to homes, hospitals, offices in Ghana. All right, Andrew.
Great, outstanding. Round of applause. Thank you so much, Dr. Prince, for that incredible presentation. I have the presentation of Thomas that I'm going to start to load up. So while I'm loading Thomas's presentation, I would like to hear from our family, our community. MIM is a family, and I want to hear some of your ideas. I'm very serious about going to Ghana physically. All right, I've done work in Botswana, I've done work in Nigeria, I have clients in those countries, and I haven't been to Ghana yet. So I'm planning a big trip right now. I'll probably go this year to prepare, but I want to do a big trip for the whole MIM family next year. What's the best time of year to go to Ghana, Dr. Prince? If we're going to spend maybe a week there, what's the best time of year?
Andrew, then you may probably have to come around Christmas time.
Now, isn't that just a party? I mean, everybody's partying. I hear everyone's partying. I want to do business meetings as well. So Christmas is a...
Okay, so Andrew, let me say come in December, not Christmas. Come in December.
Oh,
so early days in December, we do all the work and then we get to party before the
nice
ends.
Nice. So guess what? I'm gonna send my students back to the US. Then you and me, we're gonna party.
I agree to that, Andrew. 100% I do.
Oh boy, I'm gonna send them back. They're gonna be there for the first week of December. They're gonna say bye.
Yeah.
We're gonna hang out. That's good. Okay, so I want to hear from other people now. What other projects would you like to see? I think someone mentioned, going there and working with a school. Now, if you could mention that school again, Dr. Prince, you said that there's a school that already has an exchange program, and someone can maybe type the website or name, because I'd like to develop like a directory. As like a resource directory. So could you mention that school again?
So yes, Andrew, I mentioned my own alma mater. That's the University of Cape Coast Medical School, and it's not limited to University of Cape Coast. I mean, almost all the universities in Ghana, we have such programs available. exchange programs available. So, yeah.
Okay.
So the University of Ghana in Legon, Kwame Nkrumah University of Science and Technology, my school, University of Cape Coast, almost all the universities in Ghana, we have such programs available.
Okay. All right, great. So I want to start with your school, and then we can go from there. So Thomas, you ready? Is Thomas still here?
Yeah, I am.
All right, great, Thomas. So I have your presentation now. Take it away, Thomas.
Okay, thank you very much for the opportunity, Dr. Prince and Mr. Andrew. I want to talk about myself. My name is Adi Thomas Kofi. I'm a Ghanaian, practicing physician. I'm a student of Central University, offering a course of physician assistantship in my final year. So let's do this. When I wake up in the morning, I just say a prayer and pick up the day, start everything afresh, see what the day goes with. So currently, I'm in my final year, so I'm doing my clerkship. I did my first part of my rotation with Dr. Watt in Lekma Hospital. I'm in school now, taking. Can you go to the next slide, please? So working with Dr. Watson doing my clerkship around Lekma Hospital, I had the opportunity to do a whole lot of stuff with him. He taught me, he mentored me a whole lot. But my journey so far has had good and bad ways. Medicine has taught me a lot of reasons to be precise in decision making. They need to speak about the problem when necessary, how to relate and coordinate with people with different opinions, how to be honest, how to be confident as well. So I guess medicine has really, really taught me a lot. Trying to get into medical school is also another goal I want to achieve. So I think I don't regret choosing this profession at all. Can you go to the next slide? So these are some of my educational challenges in school. I think the first one we'll have to do about the availability of resources. I think some of the institutions, they lack some of the right logistics in the learning and training of students and practitioners as well. When I did my clerkship at the Lekma Hospital, I think there are some of the things that should be needed by the practitioners, by the hospital itself, to know more about the practical aspects of the course and practical aspects of medicine itself. But I think few of the hospitals that I went to and where I worked during my collection, I think some of the logistics were not available to do that. The second part of it is the outbound students mobility. That will probably be about a lot of students rising from, I think some will have the opportunity to be in medical school in Ghana, but due to the high rates of income levels, the population growth, and even high level education, they will have to move from Ghana to other countries to rather benefit or get the higher education that they need, because they think the higher income levels, the school fees, the financial aspects of life in Ghana is very, very important. It might be rather cheap in other countries. So they rather turn to different domains to get that higher education. And the third part is the poor sleep habit. This is professionally about me. When I started doing this course as a physician assistant, it was very, very difficult for me to take some few naps during the day and during the night, because you have to sit up, study, you might have some quizzes, you might have some lectures and all that stuff. So it became, my sleeping habits was a little bit interchanged. I used to sleep more than 6 hours. Now it had to turn down to 3, had to turn down to 4 hours, and a whole lot. And the third one is procrastination. So initially, before I was doing this, I tried to pursue this course as a physician assistant. I used to do things immediately when I don't want them to be done. So like, I want to do this. I'll just wait and say, oh, let's wait in the evening. I'll have to do this. But specifically when I got to medical school, I was like, things has to be done when you get your hands to it. So when the thing comes to you, you just have to finish it at once. Don't wait the next time, because the next time, that time you might not get to do it. And the disorganization and feeling overwhelmed. Initially, when I wanted to take this course, I was very, very fearful of taking a medicine course, because I thought medicine was for those who are very, very bright, those who are this, those who have the high IQ and all that stuff. But when I entered into it, I saw that you just have to organize yourselves very well. Just if you want to do something, you just have to organize yourself very well, just overcome the fears and all that stuff. And the last part is skipping of classes. This was one of my challenges in the physician assistant course that I was taking. Sometimes I might find it difficult to wake up to go to school. I had some lectures very early. I had to be time getting up to course. I was not sleeping very early. I was sleeping much. So I was not knowing how to manage my time very well. But I had a lot of friends who spoke to me about how to manage my time, and I think it helped. Next slide. So my COVID experience in Ghana, COVID has really, really taught me a lot of things in Ghana. My experience in COVID, the healthcare, medications. At first, there are some things when you go to a health center, you might just ignore, like washing your hands, doing a whole lot of stuff, not coughing, public coughing, covering your mouth and coughing and all that. But I think COVID has really helped us to modify all those stuff. And also has brought us to the awareness of mental health. A lot of people lost families, their relatives during this COVID era. And this COVID has also really brought relatives that they should know how they should manage their mental health, getting people to speak about how they feel, what they want to do, and all that. And also the educational restructurization, because of the lockdowns and all that, schools have to be closed, how they have to think about how the social distance, how they want to go to school and all that. And for the lifestyle modifications, it talks about how people have to eat very well, how to drink, rehydrate and all that, eating good food, eating very healthy, exercising and all that. Then the importance of social amenities, that is the good drinking water, because in Ghana, most of the communities do not have water, clean, good water to drink. So this COVID really brought the idea or opened the face of getting a lot of social amenities available, the importance of it to all deprived communities. For the communication, I think this COVID era has really brought a whole lot of people together. Those who could not have to reach out to friends, reach out to families and all that. And the law enforcement as well. I think around this COVID, Ghana used to have, I think, a whole lot of incidents about crime rates and all that. But I think COVID has really showed us that there are a whole lot of things that have to be done about the law when it comes to, curbing out the crime and all that stuff. Next slide. So I think my career goals is, after this physician assistant course, I want to further to do practical medicine and specialize in dentistry, because I always like to see people smile with a very nice teeth, not with an open teeth, nothing there. So I think I would like to specialize in dentistry as well. And some of my life principles that I work with is always be hardworking. You have to always be hardworking. You have to be disciplined. You have to set standards, and always help people. Try to help people, but be reserved. I always say this, that there are some people that you can help. There are some people you might need other people's help, but not your help at that moment. So you just have to know when to help some people at a point. And always loyalty. You have to be loyal to anybody you are working with, or anybody you find yourself. You have to just be loyal about whatever you do. And the time management as well. I always have to know, or I always work with time. Because my dad was like, always manage your time very well and always achieve your goals. So I think that's all I have to say about my life and all my experiences. I think I'll say a very big thank you to Dr. Boateng, Mr. Andrews for this opportunity.
All right, great. Outstanding. Thank you so much for that presentation. I'm missing a tooth back here. You have any thoughts on what should I do? I'm glad you got the neck. Let me see them. Man, you got some. Let me spotlight. Geez, wait a minute. Let me spotlight you again. Oh my gosh, your teeth are perfect. Now wait a minute. What did you do? Why your teeth so good? What's up, dog? What's up?
Just have to. I mean, your oral care. Just have to maintain a very good oral care. That's all.
Thomas, get out of here.
That's good. That's good. All right, great. So we've just got 4 more minutes left. I want to thank everybody, for being a part of something that is historical. This is the birthing of giants. This is the birthing of an incredible relationship, and you can say you were here first. All right. So when you see we're raising hundreds of thousands of dollars from Ghana, when you see we have a mentoring and medicine hospital and ambulance and scholarship and endowed chair in Ghana, you can say you were here when it begins, because powerful things start from humble beginnings. So never despise humble beginnings. That's what I want someone to get. All right. So give me a couple of years. Give me 3 years. Give me 4 or 5 years. But you'll be able to stand at the podium at the awards ceremony and say you were there when we simply had this Zoom session, and this was the birth of these ideas. And so African Chewing Stick, I don't know if someone has an idea. So I'm actually also an entrepreneur. I'm really good at creating value and creating businesses. And so we got some business ideas as well that we will be exploring. So I'd like you to join our Discord channel. Send me an email if for some reason you are not being able to log into Discord. I wonder if that person who was saying she was having problems, if she was able to get in. So we'll be using Discord as a way for us to, okay, Joy, thank you. All right, Joy. I'm feeling more joyful now that Joy is finally able to get into Discord. So we just have 2 more minutes left. I really want to respect your time. Any closing questions? Any closing comments? I want to go out with some music. See, I like to dance. See, that's what's nice about being a boss. So when you run things, I tell all my staff, everyone's dancing. Everyone listen to reggae music. Like, you can't help yourself. I'm the boss, so we're gonna have fun. Even if you don't like having fun, I'm gonna force fun on you. But no, seriously. Question. Oh, okay. I see Rashina. Okay. Asked to unmute. Yes, go ahead.
Yeah. Hi everyone. My name is Rashina. Hi, Mr. Morrison. So I actually got accepted to Rutgers University for the fall for my master's. So it's a special master's program.
Yay! Round of applause. All right. Go ahead, girl. Go ahead.
I'm really excited about that. But I just had some questions. So I think the COVID in Ghana was really interesting to me. And I wanted to know if was there a lot of disparities? Like, did they enforce wearing masks out there? Was there any disparities with just having PPE for everyone? And then I also had another question about just, I guess, the path to medical school in Ghana. Is it as competitive as it is out here? And if you guys could just shed some light on how you went about that, how you went about getting into medical school in Ghana. And I'm really excited for the medical mission as well. So
all right. We all going out there. Remember, you guys can't party with me. When it comes Christmas time, get back on a plane and go back to the US. But Dr. Prince, so talk to me about COVID, Ghana, admissions process. Go ahead.
Yeah, so COVID, I must say we've had 2 waves. So the first wave caught us it didn't catch us by surprise, but the preparation wasn't as adequate as we wanted it to be. But subsequently, we were able to put the measures in place. And then the second wave actually came after the Christmas holidays where people had ignored the social distancing and all the protocols that we had put in place earlier. But all together, I must say that Ghanaians have been quite obedient in this era in trying to adhere as much as possible to the necessary protocols. So yes, we still have stubborn ones out there ignoring what they have to do, but generally, I think Ghanaians can be commended for how they have taken this seriously. So over the days, I think we are now recording lower cases after the second wave, and then after the second wave, we ensure that we enforce the protocols more. So things are better now, and relatively, yeah, people are following the protocols. Yes, medical school is tough. I don't think it's any different in any country. As I told you myself, I was denied admission when I first applied to my university, and then I had to apply the next year before I was considered for an interview. So that's simply it. It's as tough as it is everywhere, and people are doing their best to go in. Yeah.
But Dr. Prince, is it? Let me make sure I heard your story properly. Didn't you have to almost repeat 4 years of an undergraduate education before you got into medical school?
Exactly. So Andrew, the story is I did 4 years of an undergraduate program. Then I had to do my service to the country, that's my national service. Then applied the first year and I was denied admission, and I applied again before I got in. So it has been more than 10 years of struggle to becoming a doctor.
I just want to make sure all of my MIM students understand what he's saying. Some of you are complaining about this post-bac, I got turned down, what am I going to do? This man did 4 years of an undergraduate education, then he did national service, then he applied and got turned down. And he applied again. And then he ended up winning like 11 awards at the graduation ceremony. So Dr. Prince is not all that smart.
No. I've had my challenges. Yes.
He's dedicated. He's dedicated. All right. It takes dedication to become a doctor. And it's so great to see, oh my gosh, Suzette Burnett from college. Man, oh man, oh man. We got some friends here from college. I don't know if you're gonna say some closing words. Okay, so this is overtime. Let me give Joy a chance to speak. Go ahead, Joy.
Hi, hello. My name is Joy Adeye. I'm currently a second-year medical student at AUA. I used to do mental medicine when I was in college, City College with Dr. Holden. I still get your email, so I saw this and was very interested. So I definitely hopped on. I was just curious. I'm a Nigerian American, so when learning about certain things in medical school, I can see how it relates back when they say this is prevalent or very heavy in African countries, such as sickle cell. Sickle cells is something that, from my own personal experience, I've seen that is definitely harmful for people in our culture. And when learning about it, we always see that this is mostly in African people. So I just wanted to know how it is in Ghana as well. Is there a high mortality rate as well in Ghana? And if so, is there, what can we do as future doctors to help coming back home to help either Nigeria, Ghana, any other African countries? What is something that we can do to help with that? If you have any ideas for that, or what is something mental medicine could do, or anything of that sort.
All right, Joy, thanks so much. So yeah, sickle cell is as prevalent in Ghana as well. I think currently on our ward, on our medical ward, I think we have 1 or 2 patients, and every now and then they are coming in with crisis, vaso-occlusive crisis, and then several other crises that we have to manage. And as we all know, for us in this country, our best chance at addressing sickle cell issues is education. I think we still need to stress the education that it comes about because when people who are not supposed, who have incompatible blood groups actually ignore or are not aware, and then they end up having children who have those issues. So besides the education, I think education is the way forward. Stress the education, remind people that yes, you may fall in love, but then you probably don't want to have children who will be suffering for the rest of their lives. I don't think there is any love in that latter aspect. So besides education, we still need to try to find out how we can help those who have frequent crises. So the idea of trying to make hydroxyurea or hydroxycarbamide, as others call it, trying to institute SUs in individuals who have frequent crises. I think that is also the way forward. The last time I read I read an article that talked about advancements in certain jurisdictions where they actually try to isolate. That is when the zygote or the before the individual is even born, they try to isolate the cells that have that mutation, so that the child born will not have that problem. But I think we are not there yet as Ghanaians. So for now, our best bet is enhancing education and then trying to support those who have the condition already as much as possible. Yeah.
All right, great. Well, thank you so much, everyone. As I said, wait a minute. Are you in Aruba? My girl with the Aruba hotel in the back. Are you in Aruba? Are you? Can you unmute? Let me unmute you. Or is that just a sign you got? Are you? Because I need to come by and visit you. I need to do a medical mission to Aruba. I'm asking you to unmute yourself. I can't hear you. You have to unmute your microphone. But man, we're all around the world. Yes, I can hear you. Are you in Aruba?
No, I'm in New Jersey.
Okay, I don't need to go.
This picture was taken in Ghana when I went on vacation.
Oh, wow, that's nice.
And I use it as my background. I am originally from Aruba, so I was excited when I saw that sign.
All right, great. So we will definitely be joining you there. And T Golden, you're having a problem joining Discord, send me an email. I'll give everyone my email address. And for some reason, I want to help everybody. For some reason, the first time you email me, I don't reply. Just blame it on the head, not the heart. But so Andrew@medicalmentor.org, and feel free to bug me. You could put second request, third request, fourth request. We're all busy, but I have no excuse as to why I can't get back to you. So I'll make sure you join the Discord channel. So as we wrap up, I want to close out with some music. Let's give a big round of applause to Dr. Prince and all of the healthcare professionals and students from Ghana who joined us. Let's give them a big round of applause. Thank you so much. We really appreciate that you made the greatest investment. And all of you who are watching us right now, you made the greatest investment, which is your time. So stay tuned. We'll be coming back maybe in a couple of weeks. We'll talk more about these first aid kits and getting those first aid kits out to the folks in Ghana. So even though I began with some reggae music, I Love My Life by DeMarco, I want to close out. We've been talking about how to begin your day and how to close your day. I actually like classical music. I actually played classical saxophone when I was in high school. And so yeah, you have to switch it up. All right, I switch it up. And so think about playing some classical music when you wake up in the morning, before you go to bed. Don't just fall asleep. Don't just fall asleep. I want you to drift to sleep, all right? And prepare yourself for sleep. All the science points to an increase in neurogenesis, neuroplasticity, based upon you increasing your quality of sleep. And so I'm gonna close out with my main man, Paco Bell. This is a Pac Bell Canon D. This is how I actually, literally, I begin my day and close my day with this song.
Andrew, if you could check your WhatsApp.
I'm going to play it next time, okay, Dr. Prince? All right. So thank you so much for coming, everyone. Oh. That's a problem with YouTube. But okay, so peace out. We'll see everyone next time. Take care. There you go. As a kid that
All right. Thanks, everyone. Bye.
So thanks again, Dr. Prince. Big round of applause, Dr. Prince, and everyone. This was a
Thank
great
you. All right. Thanks, everyone. For
program. And we will do more. We're going to be coming back again. All right. So thank you, everyone. Bye for now. Join our email list.